Service Learning Project, The Food Bank of the Hudson Valley, by Lisa Gagan. The Food Bank of the Hudson Valley is a member of Feeding America, a nonprofit organization. It is a branch of the Regional Food Bank of Northeastern New York established in 1982, based out of Latham, New York, but the warehouse for which I volunteered in is in Cornwall, New York, serving the lower Hudson Valley. The mission of the food bank is to alleviate hunger and prevent food waste. Every $1 donated to the food bank equals 4 meals to hungry residents. The food bank participates and hosts various events throughout the area, including the Feeding Our Families event, the Hard Cider Run, and more. They collect all types of foods, cold, dry, as well as different products such as household supplies, sort them thanks to the help of volunteers, and transport them to various areas in the Hudson Valley based on their demographics. Over the course of 6 days, totaling 18 hours, I did various activities to help the food bank. Most of my time was spent in the warehouse with the food that was delivered. I helped to organize the food onto tables in categories after checking the labels for an expiration date. Then I proceeded to box the food up in appropriate boxes before bringing them to the weighing station. All boxes have to be under 45 pounds regardless of the items inside. Then I would label the boxes with the appropriate number code and weight and bring them to the correct pallet. Once the pallet was full, I added up the boxes and their weight, inventoried them onto the correct seat, and had my supervisor approve them for delivery. On one day, I was able to do some volunteer work in the office where I helped fold thank you cards and put them into envelopes for people who had donated them to the food bank through various events or out of the kindness of their hearts. I spent a lot of time talking to the workers about how passionate they were to feed the families and the residents in our area, and found out that their main focus at the time was the city of Newburgh. The Food Bank of the Hudson Valley hits objective number 2, which reads, collaborate with interdisciplinary public health professionals to assess, intervene, and evaluate interventions to improve the quality of the population's health. After volunteering with this amazing group of people, I learned that they work with local dietitians in the lower Hudson Valley to connect them with residents who need nutritional teaching. They also work with local programs such as Meals on Wheels to help feed the population. They do education at every event they host, and they encourage the donation of healthy foods for their clients. They go above and beyond their jobs to do best for the community. They don't just provide food, they provide an education and a service like no other, which includes connections with others. The second course objective that the service learning assignment fulfills is number 5, to examine the public health system structure and role in improving healthcare costs, assess and quality of populations. Each and every one of those workers are thinking critically about the population they serve. When they deliver food, they are making sure the residents are able to be fed, connect with dietitians, and improve their health. They are not afraid to assess the situation. After looking at the community at large, particularly the Newburgh area, 31% of the population is in poverty. The food bank takes that into consideration by serving the population the most because they understand that if they do, it will help the quality of the population and their overall health. After assessing the local community that is in the major focus of the food bank of the lower Hudson Valley, I realized that lack of education, internet, and language barriers contribute to a lot of the community's problems. Programs such as ChooseMyPlate.gov would be perfect for the community if they knew it was available. The MyPlate initiative helps to focus on variety, amounts, and nutrition, choose foods and beverages with less saturated fat, sodium, and added sugars, start with small changes to build healthier eating styles, and support healthy eating for everyone. They have various models for different age groups, such as college programs where they aim to put healthy food options in colleges around the globe. After speaking with some of the workers at the food bank, I found out that they connected the local community college to Choose My Plate and educated them about proper foods. So now they provide services to college students, and on-campus foods typically are healthier. Another key part of education for this community is providing them with resources and services that are available to them. A lot of the residents don't know they can seek help from a nutritionist or dietitian when they are not in the hospital. And I see this a lot at the Wound Care Center, which is an outpatient clinic. They don't realize that if they can't feed their children, the local church might have a food drive for them to get to, which is many of the churches in the area, such as the city of Newburgh. Single parents have options to receive supplies for their children for school, such as backpacks, pens, and paper. There's a couple of workers at the food bank that are dedicated just to separating out these supplies in order to bag them up for back to school supplies. Working households are able to get government assistance to help them stay above water. Unemployed residents can receive transportation to appointments and for food pickups, and the homeless are able to find comfort in knowing their community has their back and will help feed them. How to implement the learning. Food drives are the driving force in this community. Reaching out to those in public settings such as parks, school events, and public places such as the grocery store will help people to know their options. Pamphlets and directions, lists of websites, and phone numbers for people to contact, but not only that, but places where they may be able to go to get information, such as the local library and places with free Wi Fi. College fairs and outreach are key. People need to know that they have options. A lot of the people that I spoke to didn't realize the benefits and different services provided to them in this community. I expected the food bank to be challenging work. I knew going into it that I would be boxing food up and helping to deliver them to customers, but I didn't realize just how much they did for the community. I had no idea that they did education, multiple food drives, and outreach programs such as their connections with Meals on Wheels. I didn't realize that when they drop the food up at various sites, they are organizing them and helping build a balance of foods. They aren't just giving each site tons of boxes of snacks, but they are balancing it so that they're giving their customers a balanced meal without them even knowing. They're doing research on the demographics of what the populations they need to target, which right now is the city of Newburgh. They are constantly evolving to fit the community's needs, like their programs to make sure that the children have back to school supplies. I didn't realize how involved the food bank was in the community health, but I'm glad I was able to participate. It was a rewarding experience. All the pictures except for logos for my plate and the various feeding programs are all my pictures I took specifically in the warehouse during my time. Thanks for listening.